So today we are going to discuss about the medication adherence. So it is simply, we can tell as it is a passive act of the patient to follow the provider orders. Or it can be defined that how much extent a patient medication taking behavior, it coincides with the intention of the physician or the healthcare provider. That is simply the adherence. Then we can check why this adherence is very important. That is, if you are, it is important in different aspects. That is, if you are doing a replacement therapy, that is with insulin or thyroxine, this adherence to that particular therapy or a regimen is very important for a better outcome. And in case of maintenance of the pharmacological effect with drugs like antihypertensive drugs, if you are not adhered to that particular regimen, it is ineffective. We know that if we do not take the antihypertensive drugs as such or in the particular timing, it will not have the particular side effect what we expect. Then, in case of the maintenance of serum drug concentration to control a particular disorder, that is, in case of anticonvulsant drugs, it is very important. That is, we have to maintain the certain limit or certain amount of drug concentration in our blood or plasma level to maintain that. Then, in case of controlling the diseases of public health like HIV, TB, etc., that is why in case of TB we will follow the dose therapy and all, because that regimen, that particular scheduling, that frequency, everything is important. That is why we follow this. All this scheduling technique. Why it is done? Because this adherence to that particular regimen is very important. Then in other cases like chronic diseases, different chronic diseases, contraceptive pills, what we are using for birth control, then overdose, which can cause serious hazards, etc. So when we take all these cases, this adherence is very. Then medication non-adherence. We told about adherence. What is adherence? That is, they adhere to that particular regimen. But non-adherence is simply the unintentional or unwitting behavior or the failure to take the medication from the patient side. That is, whatever intention the physician is giving the medicine, the patient is unable to take the particular regimen or particular dosing or frequency, etc. So that is what medication non-adherence. Then what are the categories of the medication non-adherence? This classified into primary as well as secondary, and the secondary is again classified into intentional as well as non-intentional. That we will discuss later on. So what is medication non-adherence? In case of medication non-adherence, this non-adherence can occur either intentionally as well as non-intentionally. If it is an intentional medication non-adherence, it can simply be defined as the active process whereby the patient chooses to deviate from the treatment regimen. Whereas in case of unintentional medication non-adherence, this is the passive process in which the patient may be careless or forgetful about the adhering to the treatment regimen. So these are the medication. So we can look into the next important portion, that is the role of pharmacist in improving the medication adherence. As a pharmacist, we have an important role in improving the medication adherence. That is, we often provide the verbal education and individualized information about the disease, the need of medication, why it is important to them. Everything we will counsel. So by this method, we can find out what are the different risk factors that is in having a proper adherence. We will be able to know about the development of a treatment plan, which treatment plan will work for one particular patient. The one treatment plan which works for one particular patient will not work for the other. So that type of treatment plan development, that scheduling, everything can be done if by the pharmacist, as well as the patient motivation. Why this patient motivation is needed is some patients, they will think that if I take the medication, we will have a lot of side effects. So they will not take the medication properly, or they will skip the medication. So that skipping of medication is very dangerous. Like we say, it's dangerous or ineffective. That we will not receive the desired outcome from that. You think about the antihypertensive drug. What will happen to them if they do not take according to that treatment regimen or schedule? Or if you take about anticonvulsant drugs or simply anti-diabetic drug, if you are not taking according to the particular regimen and schedule, the outcome is very worse. Whereas it will not be like that. So, we already told that it can be intentional as well as unintentional. So, from the counseling, from the like providing counseling to the patient, we will be able to know, we will be able to gather a lot of information from them. So we can understand whether it is intentionally they are doing or unintentionally they are doing. So everything, so based upon that, we should motivate the patient to adhere to that particular regimen. Or if it is not possible, or if it is an elderly patient, or if the patient is having some serious condition, which he is not able to adhere to the particular regimen, as a pharmacist, we should be able to provide, we should be able to help them to for a proper compliance with the treatment regimen that is prescribed. Next, we are going to discuss about how we can provide the compliance aid. That is, compliance aid can be given simply in the form of a labeling. That is, this labeling can surely help the patient to understand what is the name of the drug, when I should take the drug, what time, what is the frequency, everything we will be able to identify from that labeling. Otherwise, we can provide a medication calendar. That is, the days of the week will be described in the calendar, and which day, what time it should be taken. All these we can give in medication calendars. Otherwise, we can provide a drug reminder charts. That is, whether if we have taken the drug, we can mark it that chart. Likewise, a drug reminder chart can also be given to the patient to improve the adherence. Otherwise, like in the figure, you can see the compliance packing. That is, either it can be a blister packing. Likewise, it can help the patient to identify which type of drug is that, or which drug we should take at a particular time. Otherwise, different dosage forms. That is, instead of giving the same dosage form, we can give different dosage forms so that they will be able to identify this I have to take at this particular time. Likewise, they will be able to identify everything, and likewise, the adherence can be improved.